y'all continue to wear your mask in here. We appreciate it very much. Thank you.
Do I still need to wear it while I'm speaking?
No.
No, so I can take it down while I'm speaking. Is that okay? Okay. Thank you. All right, good evening, Chairman, board members, superintendent, admin. It's July 2021. All summer, we have been able to choose whether to mask or not nearly everywhere we go. My children can go with me nearly everywhere maskless because we have been given back the power to choose for ourselves. The North Carolina Senate and House are currently working on Senate Bill 173, Free the Smiles Act. This bill would take the power to require masks in schools away from our state leaders and give it to you. I told you 2 months ago during public comments that when this moment comes, you need to be prepared to make that decision. In North Carolina, not all school districts are waiting for restrictions from the state to be lifted. Sure, you're aware that we've got at least 5 school districts that have either voted or are planning to vote in August to make masks optional in their schools, regardless of what the state is telling them. And there are private and charter schools that have also said that. And more specifically, Bailey's Academy, that is coming to Pittsburgh. They have released a statement that masks are optional for their schools. So why are these schools going against the state mandate? Well, here's what you know. Here's some facts. According to the NCDHHS COVID dashboard, most recent data for Chatham County shows the following. Number of positive cases last 14 days, 75. In those 2 weeks, only 13 were from under 18s, 17 and under. 42, about 42, there's a couple numbers missing, about 42 was everybody older, okay? Even if we look at the worst week that Chatham County had in positive COVID cases, there were only 30 cases that were under 18s and 216 cases for everybody else in Chatham County. That was week of January 10th. Just last week, a study was released in England, which confirmed that hospital stays were very rare in children and cited a mortality rate of 2 per 1 million children. What is also important to note is that in England, children under 18 are not recommended to get the vaccine, and schools do not require masks or social distancing there. New York Times also recently gathered data from the CDC that showed that annual deaths among children 5 to 14 years old in the U.S. were cancer, vehicle accidents, suicide, homicide, cardiovascular disease, drowning, flu, pneumonia, all those ranked above COVID deaths. Whether they are masked or not, children in our community have a very low risk of infection and severe reaction. Yet many in power are continuing to call for children to come masked to everything. Okay? We now have confusion over CDC, American Academy of Pediatrics, White House, Governor. Everybody says something different. Okay? It's a blessing that our children have had low reactions, okay, to COVID. It's a blessing that our hospitals are not filled with children. Okay? Instead, our children have suffered higher than normal learning loss, higher rates of depression, higher suicide rates. Okay? Correcting all that is going to take years, but we have to continue to move forward and not step back. As parents and guardians, we stand and say, give us the choice to unmask or mask our children. They are our children. We are their primary caregivers. We are responsible for them, and we need to be given back that right. Thank you.
Thank you very much. Katie Henry.
Good evening. She was shorter than me, but still. Good evening, everyone. Welcome, Dr. Jackson. We do welcome you to Chatham County. We're an amazing county, and we hope you stick around for a long time. Also hope to see you out in the trails with the cross-country kids, since you're a runner. Tonight I have 2 questions that I want to ask the board for the 21-22 school year. First, will our students please be attending all 5 days? And second, will mask wearing be ruled optional? I ask that the school board helps make that motion to remove the word asynchronous from our school's vocabulary forever. Our kids can't suffer any more lost instructional time, and I hope, the nonsense of asynchronous gets put to rest. I implore us to go back to the days where we added 10 extra minutes to the school day, when we missed all those days for weather. But I do hope we're back to 5 days for the benefit of our children. I also ask that the school board votes to allow mask wearing in the school building optional for all students and for the staff. We know there are several counties, Ms. Winger just talked about a bunch of them, which have higher cases, higher deaths, and lower vaccination rates than Chatham County. We know most of our student population cannot get vaccinated for some time. We know this population is terrible at wearing masks. If you don't believe me, just look at any of our social media for Chatham County schools, and we see all the kids posing for the fun pictures with their mask around their chins. I spent the last couple months with my children and all kinds of children. We just got back from the beach. No one's wearing masks, and if they do, it's because they choose to. I ran into a school board member's grandchild last night at the grocery store, not wearing a mask. We cannot keep telling our kids it's okay in these settings, but it's not okay in this setting. We need to start following the science, following the data, plus we just need to make common sense. These are not protecting our children, they're not protecting our adults, and we need to make the option, give it back to the parents. I'm not going to stand up here and quote data and science. I'm not a scientist and I'm not a doctor. I'm a mom, and I'm done with my children being told that they are an infectious vessel in one building, but in all the other buildings, they are not. I want to get back to that feeling good about sending my children to school, which is supposed to be the second most safe and loving environment other than their own home. So we need you, our board members, to stand bravely alongside Harnett, Rowan, and Union County school boards and vote for optional mask wearing. We can band together and have the governor lift the restrictions. Thank you for your time.
Amy Kaplan.
Good evening and welcome our new superintendent, Jackson. We're excited to have you join us because as Katie said, it is an extraordinary county. So when you go to the Chatham County Schools website, it says Chatham County Schools collectively creating success. One of the ways our schools have learned to foster success is through applying what Carol Dweck learned in her studies of how and why people succeed. Do all of you know about the studies from Carol Dweck? Because they've been talking about them in the schools quite a bit. So basically, I will just summarize it for you. A fixed mindset is when intelligence is static. A growth mindset is when intelligence can be developed. Which one of these mindsets have Chatham County Schools wanted to foster to create collective success? I had assumed growth mindset until this past year. We have had more than a year of data showing that children ages 0 to 20 have a 99.997% survival rate for COVID-19. Statistically, almost all children infected with COVID-19 experience only mild symptoms or no symptoms at all. Why are we fixated on masks and forcing our students to get vaccines? With these statistics, plus examples of schools around the country without the mask mandate, and not one of these schools has had a spike in the virus. Why would we force our students to wear masks? And equally important, why would we force an emergency use authorization vaccine in our children with a 99.997% survival rate? Common sense, which suggests that risks associated with an experimental vaccine using mRNA, a new technology, far outweigh the risks associated with the infection of COVID-19 in healthy children. Why would Chatham County Schools not want to lead by example in the 2021-22 school year with a growth mindset rather than fixating only on what we thought in March of 2020?
Dr. Jackson. Thank you.
Hi. I hadn't planned to speak tonight, so I'll be short. I am a parent and grandparent, and I have opinions on critical race theory. There are many people who believe in it and not, and I think it has to have some discussion. And I think we all have opinion. I am all for people, I am all for equality, but I think it's almost in some cases creating more division in our children. They don't know. And if they're being told one thing or another, I think schools should get back to being the basics of what the education is. And some moral issues should be left to the parents and the children. We have different religious issues. We have different races. We have differences in so many, but we are all united as citizens of this country. And I think by trying to divide our children, they don't know where to turn. I see changes in children as they're being saying, you're not doing this, you're wrong, you're wrong. You let kids alone. They will meet with other people. They will meet with other children. They will meet with parents and friends and learn to make the decisions with parent input. Some people believe in it, some not. And I don't think it should be a subject taught in schools. I think it should be left to parents and other churches or other things to have their choice. Everybody has a choice in this country. We are all individuals. Our children are all individuals. And they have a right to make their own opinion. And as long as we act and treat other people fairly, we should not be brought on, well, you shouldn't do this or that. Let children be children. Let them go to be taught. Let them go and experience dealing with other people. But I don't think it should be something that should be taught in the public schools. I think that should be left out of the public schools and be a personal issue for the families. Thank you very much.
Did I
Yeah,
get that
Jacqueline.
right? Okay.
Good evening, Board of Education, Dr. Jackson and admin. My name is Edie Jackman, and I sent you guys all an email last night that had personal information in there, which I will not share in this public forum, but I would like to speak to you about the masks that we have, the things going on in our schools. I can give you all the facts, I could tell you, the statistics, but you don't need to hear the statistics. You need to hear the personal side of this, okay? Our children, in the long run, are being hurt by masks. They have more anxiety, they have fear, they're beginning to look on their peers and their adults and their teachers in their life as someone to have some kind of fear of, like there's something going on. And it's not healthy. I have seen the confidence level in my child and my grandchildren go down. I have children that are afraid to go out. And the mental health issue is huge. We have a huge amount of anxiety now that's going on, and the doctors are having, the statistics show that the doctors are having an increase, a strong increase in the amount of anxiety meds that are being prescribed to children now. That is a real concern. The masks tell children that the world is a scary and fearful place, and it's not. It's taking their innocence away. When we make children have masks, we're stifling their interaction between peers. Kids can't see mouths. They can't see the things that they need to communicate. If they have intellectual disabilities or other disabilities, that impedes their ability to be able to communicate, the teachers with them, the kids with other kids. This is huge, okay? I want to share with you something from the British Medical Journal. It's just a short paragraph that says, and this is, they were doing a study on masks and the results from children. They said, furthermore, face masking can provoke an increase in stress hormones with a negative impact on immune resilience in the long term. Face masks prevent the mirroring of facial expressions, a process that facilitates empathetic connections and trust between pupils and teachers. This potentially leads to a significant increase in socio-psychological stress. During childhood and puberty, the brain undergoes sexual and mental maturation through hormonal epigenetic reprogramming. Several studies show that long-term exposure to socio-psychological stress leaves neuroepigenetic scars that are difficult to cure in young people and often escalate into mental behavioral problems and a weakened immune system. My point is this: our children need to get unmasked, okay? If not, if you do not unmask our children, you better come up with some money to help provide for them in the future and for their social and emotional and mental stress that they're gonna have in the future, because they will, mark my word. So I'm just asking you to please unmask our children.
Neil Johns.
I'm here to express my opposition to masks. First, to express support for the opposition to critical race theory. I encourage everybody to teach our children how to think, not what to think. Our children have been exposed to misleading information. We all, as citizens, have been. We've been told to wear masks if we can't socially distance. We've been told to wear masks even if we can't socially distance. We've been told to wear 2 masks. We've been told to wait until we are immunized and we don't have to wear masks, and we have been told we have to wear masks anyway. We've probably all seen people walking across parking lots and there's nobody 50 feet in any direction of them and they're wearing a mask anyway. So people are responding to the leadership that we've all seen of fear and panic. And it's time for that to end.
Claire Cajado, Cajado?
I won't make you try to figure it out.
Okay, thank you. Thank you.
Thank you. Yes, I'm Claire Cajado. Thank you for this opportunity. A month ago, my family packed up and moved from Utah to come to North Carolina and come specifically to Chatham County. This is where my family is supposed to be, and I am grateful to be here. But I am not grateful for the idea that someone else is telling me what my children can and cannot do, and that includes wearing a mask. My own niece got COVID. She was 3 years old when it happened. It was because she had a lower immune system. She, because of those other reasons, probably should have been wearing a mask, and she was. She wore a mask because her parents had her wear it religiously. She only ever found out she had COVID because of the other complications. They did not treat her in the hospital for COVID. There was nothing to do for the COVID. They treated her for the other symptoms, the other problems she had that caused her to have to go to the hospital and get tested. They did not treat COVID. She is just fine. She did not suffer from the COVID. My children, on the other hand, are anxious, are worried about if they have to wear it, if they shouldn't. Mom, I see someone else wearing the mask. Should I? Do I have to? And that's not something that they should have to deal with, especially at school, when they need to see their teachers' faces, their eyes, their expressions, their smiles, their encouragement. From here down, you do not see encouragement from me at all, only without the mask. If masks are what this county decides they have to wear at school, let them choose a face mask or a face shield. Let them wear their box around their heads. But more importantly, it needs to be the decision from the parents. I need to be the one that can say what my children do or not do. That is my job. That's my responsibility. I am here tonight begging for you to listen to us parents. Let us be the ones to decide. Thank you.
children in Chatham County. My children, however, are no longer in Chatham County schools. I've already made the decision to pull them out, and I wanted to give you the reason why. I'm not a public speaker, so I'm a little bit nervous, so be patient. I honestly felt like I had to speak because so many parents can't because they fear retribution against their children. I no longer have to have that fear. I tried my best last year to give the benefit of the doubt to anyone in a position of authority and decision-making, as I know a lot of people were honestly just not sure what to do. Unfortunately, it became clear fairly quickly that almost all decisions ended up being made based on fear instead of facts. However, we are now a year and a half in this mess, and people in positions of authority still seem to be making decisions based on fear and not facts. Quite frankly, to still be considering that masks be mandated for anyone, but especially for our children, is just wrong and not at all based on facts. I've heard from my own children how much they hate them, and I've also, like so many other parents, heard truly heartbreaking stories about not only the physical toll that they take on children, but also the mental and emotional toll. A growing number of medical professionals agree that the risk of masks, psychological, physical, and emotional, outweigh any benefits. Even with this new variant, children have very little risk of contracting the virus or the spread of it. And if they do contract it, fortunately, their symptoms are overwhelmingly very mild. Most importantly, by this time, any adult who wants the vaccine has had ample opportunity to get it. Put simply, it is past time to end mask mandates for our children. Any family that wants their child to wear a mask can send a mask with their child, but it should be optional, not mandatory. Thank you.
Okay, thank you all. Do we have a motion to approve the consent agenda? And a motion and a second, and Ms. Decker, I'll let you call the roll.
All right, folks, we're leaving, so.
Aye. Thank you. Okay, we're at, let's see, Dr. Jackson, your first superintendent's announcements, comments.
Thank you, Mr. Chair. Thank you so much for the kind welcome. I just have two very brief items. First of all, I arrived on July 6th. I have been spending the time meeting staff and getting out to visit summer school sites. I will say to you that in 2.5 days, I visited 20 schools. And I've met every principal and excited about the work that we are starting. We will be announcing over the next 10 days a very detailed entry plan with specific activities where I will be working very hard to get out, to meet with parents and families and to begin to get to know the community more intimately. But as I familiarize myself with Chatham County, I'm learning about a lot of the excellent programming that produces students like you'll see here at George Moses Hogan Middle School. These students just learned placed fourth in the nation. So even in the midst of all of this, our students are still doing well, and our students are still moving forward. But they placed fourth in the nation in the 18th annual Capitol Hill Challenge. It's a national financial education program. I need to tell you that the competition these middle school students faced included high school students from every United States congressional district. The students had to demonstrate their investing skills by managing high-performing, diversified portfolios. Some of us can't even do that, but they did and did well. At least 10,000 students and their teachers finished the Capitol Hill Challenge, and our students here at George Moses Horton were among the top 5 in the entire country. So among middle school students, no team in the nation was better than George Moses Horton's, rising to the very top. We have a video that we'd like to share with you from our team submitted for the virtual awards ceremony. And if you will, give your attention to the screen.
At George Moses Horton Middle School, we believe that every child deserves complex, contextual, rigorous, real-world learning, and the Capitol Hill Challenge is the perfect platform for that.
I'm from Mike Davis, a 5 CP
economies and the stock market, it really changed my perspective on how to hold money, sell money, invest money as an adult or even as a teenager. If you really research and take time to learn about stocks or bonds or cryptocurrency you're investing in, then you will never lose money. As long as you take time to research everything, you'll be fine. Hi, I'm Jacob. What I learned at another challenge is that saving is important, and investment is a good way to save money for the future. Hey, I mean, that's it. What I learned from the capital challenges, if you learn and you invest your money into money stocks, gain value. I'm AJ. What I learned from the capital challenge is that teamwork is the reason for success. The entire game, our group got along the way. Money gets stripped, screws out, not us. And that's our secret to winning together.
We're extremely proud of the students, and it is my hope to use this time in this forum at each meeting to celebrate the excellent work that our kids are doing, and to really show you that the future is much brighter because of them, what we're giving them today. So thank you very much.
I like the one student that said, if you follow his plan, you won't lose money. He's very optimistic. I like that.
Okay, we'll move to information items.